If you find yourself suffering from back pain on a daily basis, you are not alone. But how do you know if it's just normal aches and pains or something more serious? Joining us now is UT Health spine and orthopedic trauma surgeon with Memorial Hermann, Dr. Mark Prasarn. Dr. Prasarn, thanks so much for your time today.
Hi, Derek. Thank you for having me.
Okay, so the first question, obvious then, for a lot of people, and back pain, neck pain, so common, how do we know when it is time to go see a specialist? Because we want to prevent long-term damage here.
Great question. So neck and back pain is very common, as you mentioned. So up to 90% of people suffer from neck or back pain at some point during their lives. Again, it's a common ailment, but kind of trying to figure out which ones are more serious is a great question. Typically, we're concerned if it persists for an extended period of time, if people have tried non-operative management and failed to get to a relief, or if they have any neurologic symptoms. And what I mean by that is if they have numbness in their extremities, weakness, shooting pain down their arms or legs.
And Dr. Prasarn, Memorial Hermann Orthopedic Spine Hospital Spine Program, I feel like we're so lucky here in Houston that we have access to specialists such as yourself. People fly in to get treated here. Let's really underscore this idea, though, that seeing a specialist doesn't mean surgery will always result. There are plenty of non-surgical options, correct?
Yeah, that's correct. And I see lots of patients, and plenty of them are surgical, but we see lots of patients that, have just had neck or back pain. And we, of course, try non-operative or conservative management first. A lot of people benefit from physical therapy. We have great physical therapy here at Memorial Hermann Ironman, and we typically try that, first-line treatment. We're also developing a pain program where we're integrating some anesthesiologists and some of our rehab folks to help with pain management with injections and other things that are a little bit less invasive than going straight to surgery.
Let's also talk about this artificial disc replacement surgery. This sounds really interesting, and you found it to be quite effective.
Yeah, so one of the more common procedures I do is a cervical disc replacement. They haven't been shown to be as effective in low back degenerative disc stuff. But in the neck or the cervical spine, a lot of times people have what we call stenosis or narrowing, or a disc herniation pressing on a nerve of the spinal cord. And those are good surgical candidates if they have the right symptoms. Historically, what we would do is remove the disc and do what's called a fusion, where we would fuse or weld the two vertebrae together. But now we have these newer implants. It's a mobile bearing device that basically you put in place of the disc, and it still preserves some of the motion. And the thought is that it'll help prevent further degeneration down the road, and then potentially the necessity of needing future surgeries.
What is your message to someone? I mean, let's say one of our viewers out there is waking up with this chronic pain in their back and their neck, and they've just sort of thrown their hands up and thought, you know what, this is just something I'm going to have to live with. What's your message to them?
I think if they have tried, all kinds of modalities of treatment, like I mentioned before, like physical therapy, exercise, pain management, maybe it's time to see a spine specialist. Typically the first line, physicians involved with a patient with neck or back pain would be their primary care doctors, because it's such a common ailment. And typically it's treated conservatively. But I think if, you've failed all measures, then maybe it is time to see a specialist.
And life is short, right? I mean, your quality of life, your neck and your back, we literally need them to do pretty much anything we do throughout the day. So people do not have to live in pain every single day.
Hopefully not, and it is pretty miserable. I mean, I've had issues myself, low back issues. And, again, with appropriate non-operative management, people can get better.
Let's talk, before we let you go, too, you guys do something really cool. You give patients the opportunity to actually, in a group setting, share their experiences in the pre-op stage and also post-op when they're in rehab.
Yeah, so, at Memorial Hermann Orthopedic and Spine Hospital, again, like you mentioned, we're very specialized there. We have a spine class where patients come in and they meet our nurse navigator, Susan, who's fantastic. They get to meet other patients, and they talk about the procedure that they're going to have, so they can kind of share stories and give each other advice and learn from Susan. They get taught like preoperative education stuff, like what to do before surgery. I'm a big believer in exercise and fitness, so a lot of them are taught, preoperative exercises and things to do. And then so they have their procedure, and then postoperatively, we treat the patients in continuity with, sometimes therapy or home therapy as well.
Well, Dr. Mark Prasarn, we got to leave it there. Thanks so much for your time today, and the reminder that life is short. You don't have to live in pain.
Thank you for having me.
Thanks so much. And if you would like more information, you can visit memorialhermann.org/orthospine, or you can call 713-222-CARE.